New this morning, it's no secret that we're seeing a shift in population. Our state is becoming more diverse, and yet the nurse force in Colorado isn't. Put simply, when we don't diversify our healthcare providers, we marginalize communities of color. One CU nursing grad is on a mission to give every student on campus a voice.
She makes it look so easy.
Hello. Hello. Good morning.
Taking care of her patients.
Just take a deep breath for me.
Yet getting to this point, becoming a nurse practitioner in the middle of a pandemic, was a lifetime in the making for Salwa Mortada Bamba.
Since I was a child, I always had a heart for taking care of other people.
Born in Monrovia, Liberia, Salwa grew up in the middle of a war.
I started to work for the United Nations at the age of 12.
Fast forward to here at the University of Colorado College of Nursing, where she faced another hurdle.
In my cohort, I think we were about 150 students. Maybe about 5 of us were minority students.
The lack of diversity was isolating.
Unnoticed, unimportant, not valued, unheard, like we didn't have a voice. Sorry, it's becoming emotional for me.
Salwa knew she had to take action.
We decided to form Future Voices as a way to help bring light to some of the turmoil, some of the lack of peace that we were feeling, the lack of diversity, our voices not being heard.
A new student group paving the way for more minority students to enter nursing.
So one for each foot. It makes a difference in the lives of the patients when they see, when they're cared for, when they interact with people that look like them.
And now she's living out her passion at Colorado Primary Care, a warrior helping break down systemic barriers to create equal access to health care.
Honestly, I feel like a hero. I really do. Because I know that I don't care how small the act is that I'm doing or may seem, I know that I'm making a difference in someone's life.
Absolutely is. And since Salwa has shared her story, CU College of Nursing has hired a diversity coordinator to focus on the issue of diversity and equity in their program. And you know, research has shown that if your healthcare provider looks like you, speaks your same language, it can make a really big difference on your outcomes. You know, you trust your provider more, you're more likely to tell them about the cultural issues that you're going through. And a lot gets lost in translation as well. So it's great that CU is looking into diversifying now.
Yeah, it's kind of too bad that it had to take her stepping up to do this, but good for her, that's for sure.
Absolutely. Well, by the way, I need your help looking for warriors. If you know of someone overcoming obstacles and helping others, let me know. You can nominate their story at 9news.com/warriorway. We feature warrior stories every Wednesday morning right here on 9 News Mornings.